I believe you guys have already been studying these spots and know where these spots are exactly and what these spots are about, at least to a certain extent. Bisoma yang points. There are 10 acupuncture points that are yang in nature. In Bisoma, there are 10 acupuncture points that are used. Set 1 has 5 acupuncture points. Set 2 has 5 acupuncture points. Set 1 is consisting of large intestine 1, UB66, gallbladder 41, small intestine 5, stomach 36. Set 2 consists of 5 yang points also, gallbladder 44, small intestine 2, stomach 43, large intestine 5, urinary bladder 40. Okay, that's all you have to know with the yang points. Now, for the next, for the yin points, liver 1, heart 8, spleen 3, lung 8, kidney 10 are 5 yin points to know. That's one set, set 1. Set 2 is lung 11, kidney 2, liver 3, heart 4, and spleen 9. That's all you have to know. 10 points for yin sets and 10 points for yang sets. These are all 20 points that Bisoma acupuncture consists of. And this will treat everything. This is all you have to know for Bisoma. Why Bisoma? Well, because there's only 2 sets to use. Bi means 2, Soma means body. There's 2 types of bodies. One type requires 1 set of acupuncture points, and the other type requires another set of acupuncture points. Bi means 2, Soma means body, referring to 2 body types, 2 constitutions. My background, I started since year 2000, and in 2005 is when I started doing transporting points. I learned about 16 constitution acupuncture using 4-needle technique, and then I simplified it down to 8 constitution acupuncture, and then I simplified it to 4 constitutions acupuncture. 2014, I simplified to 2 constitutions acupuncture. This is an opposite direction. We tend to go more complex as time passes because we discover more. In this case, it's taking out what is not essential and still have the same benefit. Same result, same benefit. Bisoma, 2 constitution, 4 constitution acupuncture, 8 constitution acupuncture, 16 constitution acupuncture. The result is the same. Only difference is that you get to find out the constitution when they get better. Okay. Since 2005, 11,000 new patients. Average visit per patient was 9. That means I gave 100,000 treatments in the year, 20-year period. Actually, not only me. There are 2 other acupuncturists in the clinic. They also do the Bisoma acupuncture, and we get the same benefit. It's not who does it, it's just delivering the right way. This is an example of a powwow. You see those chairs? There's 5 chairs, and the background there is not me, it's somebody else doing acupuncture. Because powwows are usually 2.5 days, Friday to Sunday. I'm there from Saturday to Sunday, about 6 hours on each day, giving acupuncture to the participants, the visitors, whoever wants to get the acupuncture. This is also another cohort study. because I invite acupuncturists over. I show them how this works. It only takes 15 minutes. And then I demonstrate. I give acupuncture to 2 or 3 people. Then they start giving acupuncture. What's good about this is, yeah, lots of experience, and it's feedback. People get acupuncture for 20 minutes. They come back 30 minutes later. They give you feedback. How was it? It was good. Okay, let's do repeat. And then they come back. They give another feedback. How was it? Oh, it was even better. That's the usual reply. And those who don't see an improvement with the first set, then it's an opportunity to give them a second set. After the second set, ask them how it was, and they give you a reply. I think you know that transporting acupuncture points are pretty quick and fast in relief, fast and significant in relief. So it's pretty quick, and people are able to notice because it changes that much. And they're able to give a feedback right away, even during treatment. You could count them yourself probably. There's 6 people sitting, 7 people sitting, and the person with the blue clothing is giving acupuncture to the person with the white shirt. Let's give an example. One patient, she had neck pain from 6 out of 10. First treatment, reduced it down to 2 out of 10. Low back pain from 8 out of 10 down to 3 out of 10. Left hamstring pain from 8 out of 10 to 1 out of 10. So they have multiple things, and they all get better at once. Or this person might have gotten 1 or 2 treatments. I don't remember. I think we could probably get to the case after this. Right shoulder pain, 5 out of 10, down to 1 out of 10. Menstrual pain. She was having menstruation at the time, and after acupuncture, it went down from 5 out of 10 to 0 out of 10. Powwows like this is where people gather for spiritual healing and physical healing, different type of healing. And this was a good, it's one of those comprehensive experience for them. Because there are dancers, there's drumming, and there are regalias and purpose of just getting community together and interaction. All that energy is just pretty cool and awesome. And providing acupuncture, giving them additional feeling good, both in the mind and the body, just gives them that extra of soul spiritual interaction. This is an example of a form that we used. Here you see when you read the top, it says patient name, date of birth, complaint, neck pain, low back pain, left hamstring pain. So 6 out of 10, 8 out of 10, 8 out of 10. And this person had treatment 1, neck, low back, hamstring, 2, 3, 1. You see how that's written down? The patients were probably asked, like, how do you feel as soon as they get up? And they give you a report like this. But we make sure they come back 30 minutes later and see if it's still the same, better. Because you want to verify, you just don't want people to say this or that because they may be nice to you. Because you're providing a service. So they may be nice. Some people are honest. But in order to get the honesty out of them, you got to ask them several times. Okay, this is another patient. Right shoulder pain, 5 out of 10. Menstrual pain, low back pain, 5 out of 10. So right shoulder pain, it went down from 5 to 3. Menstrual pain went down from 5 to 1. And the patient went and came back later Received the second treatment for another 20, 25 minutes. Afterwards, the patient had noticed a further improvement. Acupuncture, you can never overdo it. You cannot hurt people by giving them frequent acupuncture. It's just good. The benefit accumulates. A form like this should be used. Dr. Kiko and Tebalam, if you have different form, a better form, definitely use them. We could use paper like this, and then we need to have some kind of some secretary who would put the patient information in an app and follow up like a soap note, because it's easy to remember for a few patients, but over time and as we have more patients being added, we need to have a sharing app where we could quickly refer to what was done and then go from there, rather than doing it all over or trying to have the patient remember, or you remember from what had happened in the past. Lots of things happening. You have to make a quick call. Therefore, putting the information like this into an app is going to be so much easier. All right. These are the acupuncture points: LI1, small intestine 5, stomach 36, gallbladder 41, and UB 66. And you got here large intestine 5, small intestine 2. This is stomach 43, gallbladder 44. You notice some spots have 2 acupuncture needles, 3 acupuncture needles. Let's open up for any Q&A, okay? Because now I wanted to give you an introduction. Any thought that comes in mind, just bring it up. For example, why are you putting in 2 needles in one spot? Any questions?
Yeah, there we go. Good. You asked my question. Tell me.
Yeah, I read your mind. Okay, these needles are so small. If they're any smaller, then they'll bend. Okay, let's repeat that. I'm using the thinnest needles because hands and feet are sensitive spots. These needles are 0.18 in diameter, length of 15 millimeter. That's all I use for all these spots. I don't use any other sizes. I only use one size, 0.18 by 15 millimeter. Because they're so small and tiny, I could put multiple in one spot. Up until 40 years ago, everybody thought acupuncture had to hurt to be effective. That's why they twirled it, they plunged it, they did manipulation technique. And they thought it was good because it helped to arrive the chi. You feel the needle being caught like you're catching a fish, because muscles, they wrap around the needle. Like, yeah, that's a good reaction. Now the chi had arrived. Because of the modern technology, we don't have to do that anymore. Why? Because the result is the same. Thick needles, small needles, the result is the same. They're using nanotechnology to make these as sharp as they can. That's why you have to use an electron microscope to look at the tip. It's that sharp, but you still feel it. But it's way better than needles that were used in the past. How come same result, same benefit? Why? It's because it's like turning on a switch. Anybody could turn on a switch. Child could do it, adult could do it, elderly could do it. Therefore, all you're doing is making a connect. The amplitude does not count. Like a light and a switch. You turn on the switch, light turns on. Why? Because you got the wire, light bulb, ballast, power supply. Everything is there. The infrastructure is there. If you make the connect, voila, big thing happens. Patient doesn't have to feel anything. The result will be the same. Now, frequency of acupuncture is more important than one long length of time. I think 20 to 30 minutes is enough. Some people think 5 minutes is enough. Some people think 40 minutes or an hour is enough. What I've seen is that after 40 minutes, the result is not as good because there's a refractory period. Refractory period means nothing happens. Okay, longer doesn't mean better. But more frequent is better. You could do acupuncture 3 times, 4 times a day. That's better than 1.5 hours one time. It's like driving a car. You put on accelerator, it moves. Slows down, put on the accelerator, it moves. So you're giving it momentum every time you add acupuncture needle to it. And adding extra needle in the middle of the treatment, let's say the treatment time is about 25 or at the most 30 minutes. Then after 10 minutes, you could add one more in. That's increased frequency rather than making it longer. Another thought of this is acupuncture points are not points. They're area. Like, for example, what you see there, gallbladder 44. Diameter is probably 3 millimeters. The stomach 43, diameter is probably 4, 5 millimeters. Stomach 36 is probably the size of a dime or a nickel. And if you're off by 0.5 millimeter, you're stimulating completely something else. Adding more needles ensures stimulation. It does not increase amplitude. It stimulates the acupuncture point where it is stimulated properly. It ensures stimulation. Therefore, more the better. Okay? Ensuring stimulation by putting multiple needles in. And multiple needles in means that you're giving more acupuncture treatments. And it doesn't hurt. Well, for some people it hurts. Little children, or some people have sensitive skin. Okay, now, yeah. Let's go to the next page. Small intestine 5. The size of small intestine 5 is probably 5 millimeter. LI1 is probably 3 millimeter in diameter. Gallbladder 41 is probably 4 millimeter, 5 millimeter. Maybe it wouldn't be a circle, but definitely length is 5 millimeter for sure. UB66, probably 3 or 4 millimeter in diameter. Again, gallbladder 44, stomach 43. Stomach 43 is not circular. It's length. Length is probably 5 millimeter. Width is probably 2-3 millimeter. The reason is because it has to go between the ligaments, and ligaments are close to each other. Not ligaments, tendons. Tendons are close to each other. Because of that, and because the space between second and third metatarsal, not that wide either. Width is not that much, but the length is there. This is small intestine 2, LI5. You see this paper down there? That's the note. Oh, this person started at 12 p.m. 12:20 is when this person is going to be finished. So we put a tape on the arm with the note so that we don't have to remember. We write down when the acupuncture needle should be taken out. That's why we could treat 7 people at once. We, as in me and one other acupuncturist, at certain points, like you do it, and that person treats like 6 or 7 people at once. It's that doable. And this is not one-on-one. It doesn't have to be one-on-one. As long as you deliver, you have the same benefit. Here's LI1, small intestine 5. You can see this person wearing the traditional clothing. This event was in Sunland, California. I'm wondering if you know the area. Sunland. Okay. In Sunland, there's also, I did in Oxnard, and it's all LA area, LA Ventura. There's stomach 36, gallbladder 41, UB 66. This is one of my acupuncture treatment rooms. There are 6 treatment rooms. Main things that you want to see is that there are acupuncture needle disposal, alcohol dispenser, cotton ball, gloves, yeah, and acupuncture needles, and hand sanitizer. Those are the main things. You have those, you could do acupuncture anywhere you go. And then, of course, everything else is for convenience, like a table here, the paper, heat lamp, chairs, and you see how I'm not sure if you could tell. I have an extra wide table because it's easier for patients to put their hands out. This is a brand that I use. This is my favorite brand, but you could use any brand you want. It's because the brands, they have a pretty high technology. I think they would feel about similar. Notice the width is 0.18 millimeter. Length is 15 millimeter. These come in blisters of 10. I could open it up, put all those 10 in between my fingers, take one, stop. Take another one, put another one in. Take another one, put another one. It's quick. If I get single needle packaging, I have to open them up and I twist it, and the other one, open it up, twist it, open, and then I get arthritis. It gets too slow. So slow, the patient's like, are you gonna finish or not? Well, it's just fast. It's easier to get it done and over with. Let's go over these acupuncture points again, because I want everybody to agree that these are where the acupuncture points are at. Okay, large intestine 1, UB 66, gallbladder 41. That's between 4th and 5th metatarsal on the lateral outside of the 5th tendon. Okay, so it goes in between the 2 bones. Small intestine 5, it goes in the joint. So you could put it in like 7 or 8 millimeters. You don't go in that deep, although 5 millimeters is enough. Stomach 36 is not easy to find at first, but once you know the landmark, it's quite easy. You move your finger up the tibia, and then there's a bump that starts. And right when the bump starts at the bottom of the bump, and then you go 1 inch outside, then that is stomach 36 point. This is gallbladder 44 point. Small intestine 2 point. When you curl your pinky, there's a crease that you see. Okay, it's at the end of the crease, further away from the joint. Okay, further away from the joint. Stomach 43 is between second and third metatarsal, between the second and third tendon. It's 1.5 inches above the web. 1.5 inches. Because right at the web is stomach 44. That's a different acupuncture point. Okay. Large intestine 5 goes in between the two tendons at the base of the thumb. They call it a snuff box because when you raise your thumb, you'll see a depression. Everybody, you can see a depression between the two tendons. Very easy to find. LI5. UB40 is directly behind the knee on the line. Liver 1. Some people say liver 1 is below like 3 or 4 millimeters at below the corner of the nail. I think the result is the same. Heart 8 is a sensitive spot. It's between 4th and 5th metacarpal. When you curl your finger, pinky finger, and where the tip of the pinky finger touches, that's heart 8. Spleen 3 is what you call proximal to the joint, between the upper and lower skin, below the bone. Lung 8, there's radial artery. I hardly hit the radial artery, but because radial artery is there, you want to be careful. So you put the acupuncture needle in there, and it starts making a ticking movement, then you know you're touching it or you're hitting the artery. So remove that when you see that. So it's about 1 inch, 3/4 of an inch above the wrist crease. Kidney 10 is between the two tendons. Long 11 is at the corner of the nail. Kidney 2 is below navicular bone. Navicular bone, it protrudes out sideways. And when you feel the side of your foot and in the middle, you'll feel the bone that comes out. And that bone is a navicular bone. You put needle below the protrusion. Liver 3, I think everybody knows, between the first and second metatarsal, 1.5 inches above the web. Heart 4 is 1.5 inches above the wrist, crease, between the two tendons. In the wrist, medial side of the wrist, you'll see 4 tendons. So heart 4 is between the two tendons. Spleen 9 is when at the bottom of the epicondyle. Like you move your finger up the side of the medial side of the tibia, and then you'll get a snag because the bone starts angling sideways. So that's spleen 9 point. Any question, any thoughts so far? Okay, all right. Benefit of Bisoma is immediate, comprehensive, and lasting. Okay, it's immediate means it's quick. The relief is quick. And when it's quick, then you know you did a good job, right? This is magic, it's miracle, cool, wonderful. And then it's comprehensive because it treats many things all at once. Headache, hay fever, back pain, hot flashes. Well, you got 4 separate things going on. Well, how about a knee replacement surgery? Now there's like 5 separate things going on. You don't need extra points. This will treat everything equally well. And it's lasting. Okay. Well, this is not pain management. The person is getting better. Okay. Let's break this down further. Immediate means, okay, you could tell the difference right away, before and after. How do you know this is working? Because there's a correlation between before and after, and it's quick. They may notice an improvement during the treatment, right after the treatment, or maybe that night, or at the latest by following morning. And then they repeat these spots. It's more and more helpful, meaning now you could correlate. You can make association to the improvement because of acupuncture. Okay, comprehensive, what does that mean? Holistic. Okay, what do you mean holistic? Okay, I could explain it this way. Every human being is a network. You are a network. Within inside the whole body, it's a network. Every animal is a network. Every system is a network. You could say Earth is a network. Okay? Human being is a network. Everything is indirectly and directly related. We're used to dividing things up. I have back pain. What's good for back pain? I have headache. What's good for headache? Yeah, look them up online. Which acupuncture points are good for headache? Try it. Doesn't work. Because acupuncture is not for a problem. It's for a person. You know, natural medicine is for a person. Natural medicine is not problem-focused. Biomolecular medicine is problem-focused. That's what we learn from childhood. Because if you don't know what you're treating, how do you know you're treating it? Obviously. Yeah, well, natural medicine assumes that body's going to treat it. Body's going to figure it out, and body's going to treat it. All we're doing is supporting it. As an example, exercise, good diet. Are they active ingredients? What do they do exactly? Can anybody answer that? Not really. Because they are supportive rather than being active, rather than replacing. Replacing. Because when we're problem focused, we end up replacing body's function. That's why people get dependent on it. When you're giving medication for too long, body backs off because the help is being introduced from outside. And body likes to establish homeostasis. If the help is being introduced, like let's say 50%, then body's going to go down to 50%. Although initially the body was doing 70%, let's say. A good example is like a wheelchair. Yeah, you're on a wheelchair for 1 week. What happened to your legs? Very weak, right? Do you want to replace the function or do you want to support the function? The body has a capacity. Why not tap into the capacity instead of doing it for the body? Yes, biomolecular medicine is important, especially when it's emergency. Somebody's going to die. We don't need to support the body because time is of essence. We have to save the person. Okay? That's why biomolecular medicine is important. Another reason biomolecular medicine is important is because if you don't know how to naturally treat it, then we're going to have to rely on biomolecular medicine. Therefore, it has its place. What we're doing is increasing our ability so that we place natural medicine in an applicable place. Because if natural medicine is repeatable, measurable, then that's science. Repeatable, measurable. We can make natural medicine science. Okay. Now going back to the network thing, a human body is a network. Everything is indirectly and directly related. An acupuncture point, an optimal point, or an acupuncture point is the node within the network. N-O-D-E, within the network. Node is where, it's like a union station, where the trains, buses, taxi, all the transportation comes and goes back out to the corners. More intersection of information there is, the better that acupuncture point is. When you stimulate that spot, you're getting the whole involved. And what's cool about acupuncture is that there's no adverse effect. You either get better or you don't. You don't get better because that's not the optimal acupuncture point. You got to do the right spot. The most comprehensive spot is the acupuncture point, not a problem-focused spot. Because more comprehensive it is, the more the whole body gets involved in treating that one thing. And it treats other things at the same time. Equally. Okay, now why lasting relief? Because acupuncture is not problem focused. It's not replacing the function. It does not make the body lazy. It promotes healing. Think of any biomolecular medicine that promotes healing. Tell me, what medicine promotes healing? Does anti-inflammatory medication promote healing?
Natural medication.
I'm sorry? I did not hear.
Natural medication, like naturopathy.
Yes, natural medicine promotes healing, but biomolecular medicine does not promote healing. There is nothing that promotes healing. Maybe there is. Like antibiotic, it doesn't promote healing. It clears the excess. It gets rid of what's not supposed to be there so that the body can rebound, come back. Okay? Well, antibiotic, antifungal, antiviral, they're like, oh, great. Yeah, wonders. If we don't have a natural means to treat it, we need to rely upon those. Promote healing, therefore, the person's physiology improves. You're optimal for where you're at your age. Teenagers, you can see them being optimal. They're all over the place. As we age, we decline, but we cannot blame it all on the age, because when our body is more optimal, we see that there's more capacity than meets the eye. Because acupuncture promotes healing, the body is in a better physiological state, and it identifies problem and corrects. That's why it's better and stays better. Like, for example, even not just functional, let's say back pain because of arthritis, disc herniation, smaller space, they get better, stay better. Why? Because the body is in a better healing state. That's why they are experiencing less pain and less inflammation. Not because acupuncture reduces pain and inflammation. Acupuncture promotes healing, therefore less pain, less inflammation, better function. Okay, now what does acupuncture treat? Then you see A to Z, right? Bisoma treats A to Z also. Okay. For example, mind thing, anxiety and depression. Okay, I'm going to give you an analogy here. How does acupuncture treat anxiety and depression? All right, there are 4 influences. Mind influencing the mind influencing the body influencing the mind, body influencing the body. 4 influences. What does that mean? Mind influencing the mind is something like, oh, I read something or I hear something, a good idea, and now my understanding of the world is a little better. Mind over mind. Mind over body is something like meditation, or maybe the person is stressed out, the body doesn't feel good, or the person feels good, therefore the body feels good. Mind influencing the body. Body influencing the mind is the body does better, therefore mind feels better. For example, brain and the gut have the strongest nerve connection. A lot of nerves connect. When a person has stress in the head, they'll have stomachache or stomach trouble, digestive trouble. If the person has digestive trouble, now they'll feel stress in their head. So you go different directions here. Mind affecting the body affecting the mind. Acupuncture promotes healing. Therefore, promotes healing all throughout the body because it's treating the whole network. When many little things do better, it's sends all that information up to the spinal cord into the brain, and the subconscious part of the brain, it calms down. Therefore, your conscious mind is like, huh, I can rest now. Doesn't that sound like it's treating anxiety and depression? Yeah. Because the body is better and you're sending information back into the brain. Acupuncture treats the body, therefore treats the mind. But acupuncture does not treat the mind directly. It's not changing anybody's mind. Okay. All right. Next thing, chemotherapy and radiotherapy side effects. I have patients come in after second, third. Yes.
But if we give acupuncture with breathing and with relaxation technique, then it will affect on the mind as well.
Correct. The thought is that while they are getting acupuncture, give them the relaxation technique. Yes.
Yeah, like a yoga nidra or something we can give, and we can tell them to go do deep breathing, focus on your deep breathing. So automatically it will change the mind as well.
Correct. Yeah. Because that's also another natural medicine.
Yes, sir.
You could do 2 natural medicine at once. Why not? Why not 3 natural medicine at once? Even
Yeah, so that's why.
yeah. Okay, good. Right. Now for the chemotherapy and radiotherapy side effects, I've had patients come in after the first, second session and they feel very bad. Headache, fatigue, neuropathy, nausea, body ache, just everything is just, you know what chemotherapy is, right? Kills anything that grows fast. So that's going to kill the body too at the same time. So hopefully the body doesn't die first. So then the body breaks down in many, many ways. And this acupuncture helps all those many ways. Crazy good. Headache. Could be tension headache, migraine headache, cluster headache. Acupuncture treats all different kind of headaches. Hot flashes. Menopause, you know that's about 6.5 years for ladies. Raging hot flashes, day and night, excessive sweating at nighttime. After a while, they could go crazy, but they don't show that they're going crazy. That's how strong women are. But they suffer. And acupuncture Bisoma can get rid of at least 90% of these symptoms. Okay. And even those who are taking tamoxifen, even if it's a medication, it gets rid of estrogen from the body. For those ladies who have had estrogen-sensitive cancer treatment, and then they're on tamoxifen for 5 years. And that means artificially induced hot flashes and night sweats. Even though they're taking medication, acupuncture gets rid of 80-90% of the hot flashes and night sweat. Okay. Muscle and joint pain, well, that's the most frequent condition people see acupuncture for. Neck pain, back pain, shoulder pain, elbow, wrist, fingers, knees, hip, foot, joint pains, muscle pain, sports injury. Yeah, we're familiar with that. Nausea, vomiting. Insurances started covering for acupuncture in the late 80s for nausea and vomiting, not for pain. So acupuncture should be good for treating that. So when do we see the nausea and vomiting most often? Chemotherapy, okay. And the other is pregnancy. First trimester, first 3 months, nausea, vomiting. Acupuncture helps quite a bit. Okay, next thing, physical trauma. And well, that's also sports injury. Well, when you look at the bottom there, post-surgical recovery, like a hip replacement, knee replacement, or shoulder surgery, or back surgery. That's also physical trauma. Acupuncture promotes healing, therefore the healing rate is faster and they have less pain during the recovery. Okay? And then pregnancy-related issues. Breech pregnancy, delayed cervical dilation, labor pain, nausea and vomiting, premature contraction. Okay. Breech pregnancy is the baby is not turning downward. The head is not turning downwards. Okay. Can acupuncture help? I think so. Delayed cervical dilation. The lady is supposed to deliver at the end of 40 weeks. Cervix is not opening up. It's not dilating. So, you might need to get a C-section. Do we do acupuncture to help induce labor? Open it up? Get the contraction going? Sure, do that. And then it also treats premature contraction. I had this one patient, she was 7 months pregnant. She was having contraction. She was supposed to have contraction at the end of 9 months, not 7 months. So this was 2 months before delivery. It was a threatened pregnancy. She was in the hospital for 1 week. She took medication, came out. Contraction went down by half. She got acupuncture. Contraction went away in 4 treatments. I saw the baby a year later, and she delivered at the end of 9 months. Let's use the word balance. Premature contraction, acupuncture helps to reduce the contraction. If there's delayed dilation, which is opposite, then acupuncture helps that too. Then how come? Because of the timing. If the lady is 7 months, then you cannot have contraction. The body knows that. If she's at the end of 9 months, the body's got to open up. The body knows that. We're working with the balance of things. We're not making things happen.
Is it a different set of points you notice it works for when it's talking about either one of those?
No, still the same points. That's why I said balance. Same points, different timing, different need.
So out of those choices of those of either of those sets of 5 points, is there some conditions or constitutions that you know points work better for through those study you've done?
No, it's equal for all the constitutions. Good question. Because your question is related to differentiation. Okay. One type of differentiation is differentiate between problems, different situations. And the other is differentiation between people. There's no correlation.
For a satsang constitution?
I'm sorry?
For a satsang constitution?
For satsang constitution, correct. Correct. These spots are constitutional. I said there's 2 body types, 4 body types, 8 body types, 16 body types, and then we have 8 billion people on Earth. So I guess we have 8 billion body types. Everybody's different in one way or another. But we could group them together. And we group them down to 2 types. That's why there's set 1, and then there's set 2. And why do we say constitution and body type? Because these are genetic. Can you change your genes? No. You're born with them. You're born with that set of information, and they're never, ever changing. That's constitution. We're discovering constitution. Regardless of what you have, what you're doing is giving the right information to the body, and it already has the infrastructure, it gets reminded better. 2, identify and correct. Body is always identifying and correcting itself. It gets compromised, now you have a problem. All you're doing is supporting, helping, improving the body's ability to identify and correct. Okay, it's that simple. This medicine is so simple, it's crazy simple. It's just crazy simple.
So on the portion where it says the one group of points treats 70% of conditions, would you relate that back to saying like Tai-Yin Constitution people, 60% of the population? We say those points are treating mostly Tai-Yin people.
Ah, okay. All right. Well, good. I'm glad you know about the Shashan constitutions. We'll get into that sooner or later. Definitely will. Dr. Kumar, this might be a first time that you're hearing about Shashan constitution. Shashan means for body in Korean. Koreans are the ones who came up with the 4 constitutional medicine with acupuncture, diet, and herbs. Okay? And this was invented the herbs and diet was invented or discovered 150 years ago. Okay? Acupuncture for the Constitution was discovered about 70 years ago, but not completed until about 15 years ago. Or maybe 20, well, I'll say 25 years ago. Okay? And then once it got completed, then it had to be verified. Okay? And you know Ayurveda, right? Ayurveda has dosha. Dosha is, 3 dosha. You know, dosha is constitution, correct? Pitta, Vata, Kapha. Okay? And Dr. Kiko, he mentioned about Tai-Yin constitution. There are 4. So there's Tai-Yin, Tai-Yang, Xiao-Yang, and Xiao-Yin. Okay? But I'm going to make it just make it simple this way. Tai-Yin is Pitta Kapha combination. Oh, right? Different name? Same people? Okay, you're smiling. That's good. I'm glad you're following here. And then there's Xiao-Yin constitution. There's 2 types of Xiao-Yin. One is Vata, and the other one is Kapha. Okay, so you follow that, right? Okay. And then Tai-Yang or Xiao-Yang, they could be used as one because they're both Pitta Vata combination. Okay, that means your language is my language, your application, my application, we could unify. Okay, now we have a world medicine. Okay, all right. And this Bisoma acupuncture is important in verifying what I just said about Ayurveda and Korean 4 constitution medicine being the same. Okay. When we have opportunity, we'll get there. All right, so Dr. Kiko's question is, in Tai-Yin, the set 1, set 2, are they different from set 1 and set 2 for other constitution? The answer is no, it's the same. It's like saying Vata has set 1 and set 2, same frequency. Pitta has set 1, set 2, same frequency. Kapha has set 1 and set 2, same frequency. Okay, so this Bisoma acupuncture is like gravity. You go anywhere on the world, gravity is the same. No matter what you do, how you look at it, it's the same pattern with everyone. Okay, so that makes it even more simple. All right. And that's what I was just mentioning. It's effective across all humans in all continents because Bisoma is like gravity. It just works everywhere. Okay, same. Okay, since you guys know these acupuncture points, you see that they're on the limbs, hands, and feet. Okay. Same points can be repeated because these are constitutional points. And it can be repeated at different times. The more often you do, the better it is. And for different problems, you do the same spots. There's no diagnosis necessary, no difference of diagnosis whatsoever. Thin and thick needles are the same. I mentioned that because it's like a switch. You're making a connect. And needle, you've heard that you got to put needle along the meridian path or against the meridian path. You've heard about that? Doesn't matter. You could put just needle in there and that's it. You're making a connect. You're not manipulating. You're not making something happen. You're just connecting. That's why needle direction does not have any influence to this. Simple. Okay. All right, complements other acupuncture technique. That means, yes.
How we know that it's connected or not?
You mean here?
Yeah, like you mentioned, sir, that it like you will put on the actual point. So like when we know that it's okay, like sometime like will not find the actual point. So like any technique is there or anything is there that we can know that oh now we put at the actual point.
No, because the needles are so small and thin that oftentimes people don't notice anything. And
Yeah.
it's still good. So like
Yeah.
when you manipulate, you're talking about amplitude, amount of energy that you have to put in to make it work, right?
Yeah.
But if you just put it in, then it just connects. Hard to, yeah, because we have to do acupuncture technique at school. Now I'm saying you don't have to do it, any of it. Patient doesn't have to feel anything. No arrival chi, nothing. The result is the same. Okay.
Is there, you were saying that 15 years ago or at some point they discovered that you don't have to have the arrival of chi to make the connection. Is that, where do we see that information? Because I'm just, this is stuff that I want to spread on to other very traditional acupuncturists that are going to have a hard time believing this. You know what I'm saying?
Okay, two replies. First, let them do what they do. Because, that's been ingrained in, so you're not going to convince anybody.
Uh-huh.
Okay. Second thing is, you do what you do. Okay. What I mean by you do what you do is, I discovered that. You notice this acupuncture is so simple. Least amount of variable. So I put the needles opposite direction. Any direction, random direction, whatever. The result is the same. Okay. At the beginning, I said my clinic gave 100,000 treatments since year 2005. Okay. During that whole period, there was a lot of experiment. A lot of intentional experiment. Opposite direction, same direction, mixed up directions, all same benefit. And not feel anything, same benefit. Feel a lot, same benefit. Crazy. Okay, complement other acupuncture technique means this. As long as they're not transporting points, like for example, you do like head point or abdominal point or back point or tongue points. You could do a combination. No conflict. Okay, now let's take should we take 10 minutes?
Oh yeah, sorry. I was gonna say, do you use two of these points at once? Did you do that, like testing on that? Like two sets at one time?
Okay. We didn't get to the technique yet.
Okay.
Yeah, I know. I want to get to the technique because that'll help to answer a lot of questions. But let's take a break for 10 minutes and get to the technique. All right. So it's 45 after. So exactly 55 after we'll resume.
Okay. 감사합니다.
Yes. Someone else.
Leo, we just doing 10-minute break. If you didn't hear that, he said 7:55, we're gonna meet back.
Thank you. I got it. Thanks.
Mhm. Okay, very good. Any thoughts or question before we resume?
No, it's dope. I like it all. I like it all. Yes, thank you.
Okay, all right, wonderful. Let me see. I think everybody's back online. Is that correct? Yeah, okay, good.
Dr. Lee, thank
Yeah,
you so much for this. Appreciate it a lot.
yeah, okay.
And I had a quick question. I got a quick question. This is a very, 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 maybe very simple question, but like, what's the difference of putting like 2 or 3 needles in some of the points versus choosing a thicker needle and just put one instead of 2 or 3?
Hmm. Because I see that small needles have the same benefit as thicker needles. I prefer the small needles, especially on the hand and the feet area.
No, no, yeah, I definitely get that. The ones here, you want to use thinner needles,
Hmm.
but why would you put 2 needles instead of putting? Because you want to use 2 needles to make it a strong stimulation, isn't it? Is that the purpose of putting 2 or 3 needles?
Rather than making the stimulation stronger, I add more needles so that the stimulation is ensured.
Oh, I see.
That's different from making it stronger. It's ensured.
Mhm.
Because
So because the
it's
oh
not a
sorry.
point. It's an area.
Oh, because the area may be different in a different body than somebody else, a little bit off. So you put it in the just around the area to make sure.
Yeah, we look for the landmark to find the acupuncture point. I didn't know they are the actual acupuncture point for the patient. By the improvement, right? Yeah. And so before you look for the improvement, you give several needles in one spot, and that ensures the stimulation, and it's easier to assess the improvement. On the tip, I don't do more than one
Uh-huh.
because the spots are very small and they're sensitive. But some people I do put in two. But other people, other areas, other spots, either two or three. Stomach 36 would be 3 needles. Even gallbladder 41, small intestine 3, small intestine 5, LI 5, 3 needles. For example, at the beginning, I put in 1 needle each, or maybe I'll put in 1 needle on the tip, but 2 needles on the other spots. 15 minutes later, I come back in and I add one more. And coming back in two purposes. One, to see how the patient is doing. Any question, any thought, anything the patient needs to say. And the other thing is so that I could add more points, more needles on the points. Does that help? Okay. Yeah, it's to ensure stimulation, not to make the stimulation better. And more often, I think it's better than one longer treatment. Kind of like eating, right? Should you have 3 meals at one time, or you eat it throughout the day? And so it's just putting in extra in between gives time for the body to register the information, and then give another stimulation for the body to register more information.
What about what they teach about you give acupuncture, like if it's a deficiency patient, you don't want to overstimulate them too much. But is that so you're saying that's not possible to overstimulate?
No,
Mm,
no, it's not possible.
mm,
You're talking about adverse effect of acupuncture.
mm,
Have you seen that? No, you cannot cause adverse effect with acupuncture.
mm.
Acupuncture is one of those weird things. You either get better or you don't, but you don't develop problem with it. You know why they say be careful with the deficient patients? Because they're used to doing this a lot with the needle. Too much manipulating stimulation. It causes patients to be more tense. Okay? And I've had, I remember a bad effect though, an adverse effect. I did acupuncture in a like a poor area. Let's just say poor area. So they don't eat food that well and things like that. So this young person was probably about 20 or 21 years old, and the area we didn't have beds, so we had chairs. Right? Give acupuncture, and it was fingertip and other area. And after about 10 minutes, 5 or 10 minutes, he started swooning, falling over his chair. And I thought, oh man, acupuncture can do that? I guess so, but he was also malnourished, in a weak state already. If the patient is lying down, maybe that's not going to happen, right? Because they're lying down. And that was only one time out of so many treatments. Maybe it was the person's condition, not the acupuncture. So during treatment or after treatment, my patients, since then, never said, I feel bad, I'm blacking out, I have dizziness. They don't say that. You know, there's always an exception. You've heard that some people are allergic to water. You've heard that before? They cannot take shower because their skin gets like allergic reaction. I know, it's like, what? Like people are made up of 70% water. How can you be allergic to water?
Must be the bleach or something in the water.
Who knows what it is? And there's also, okay, I'm going to be controversial here. Some people say we never landed on the moon. Okay, well, maybe that's true, but the point that I'm making is that there's always an exception to something. Always an exception. But the exception does not make the rule. It's so rare that you cannot even interpret what that is. Therefore, being careful with the deficient condition means that the patient is already set up, whatever the reason is. And when you manipulate too hard with the needle, it's going to be uncomfortable for the patient. And that might cause some issue. You could say mind over body. Possibly. I cannot explain why, because it's rare. I hope that helps. Because when it happens, just let it happen. It's like sometimes things happen and we cannot explain why.
Like Enrique.
Okay, so you're already thinking of a situation. Okay, all right, good. And then the next one, yeah, you saw that we were out treating like 7 patients at once, and it does not compromise efficacy. Easy to learn and implement. So we'll go into the technique and show you how easy to learn. So far, we just went over the acupuncture points. Okay, and that's all you need to know. Replicable and predictable because it's so simple. Replicable and predictable means that it's so simple and straightforward. There's less thing to consider. Like, oh, maybe because some other reason, or maybe because of this reason. There's less of those happening. It's just too straightforward. Okay. Now let's go into the meat of it. Okay. I call this step 1 I call it mental order. And it says on top here is 70% of the population. 70% of the population are born this way. I think there's a song to that. Born this way, right? Large intestine 1, we learned this at school, are metal points. And they're well points, the metal, because well, spring, stream, river, sea, that's the order, right? From the well to bigger water flowing, and now you're going into the sea as you go up toward the body. And that's one set of theory, but there's a name to it. Well, spring, stream, river, and sea. And there's 5-element association to those spots too. So that's also another way of looking at how things work. Large intestine 1 is metal. Bladder 66 is water. Gallbladder 41 is wood. Small intestine 5 is fire. Stomach 36 is earth. All right. So I think around the world, we talk about 5 elements. The West talk about 4 elements. The point is that everything is 4 elements or 5 elements. In this case, it's 5 elements. I think Ayurveda talk about 5 elements too. Okay, yeah. Oh. So then we're treating everything, all the 5 elements in this way. Okay, let's do a comparison here. What do I mean by that? Everything is yin and yang, right? Everything is 2 things. Yin, yang. If we have a master point for yin, master point for yang, now we have 2 points. That does it all, because we're made up of yin and yang. Make sense? We are made up of yin and yang, so if we have a master point for yang and master point for yin, now we cover it all. It's like hitting the sweet spot. When you play tennis racket has a sweet spot. When you hit the baseball, it has a sweet spot, so you get to hit a home run. Golf? Yeah, there's a sweet spot too. When you hit the sweet spot, then you're getting everything in place. That sweet spot is the node within the network. You are a network, and there are nodes within the network. Acupuncture points are the most intersecting of information location. More information that intersects, the better that acupuncture point is. That's why if you have a master point for yang, master point for yin, there you go. That's all you need to do. Press the right button and the whole thing does its job. But we don't have master points for yin and yang. We do have master points for 5 elements. We call them horary points. Horary points. Li1 is a metal point, correct? On a metal meridian. That's a horary point. It is the most metal of all the points. And bladder 66 is the water horary point. Water point on a water meridian. Gallbladder 41 is a wood point on a wood meridian. Small intestine 5 is a fire point on a fire meridian. Stomach 36 is earth point on an earth meridian. These are all horary points. Horary points means they are master points for the 5 elements. You're becoming so holistic that you could treat anything and everything with these 6 spots. Only 5 of these. And 70% of the population has this. Okay, now let's go to the next page.
I'm sorry,
Yeah.
Dr. Lee. Why would only 70% of population would have these master points? If every human beings have all the 5 shoe points,
Okay,
how does that work?
I don't know why. We're discovering. We are discovering nature. I don't know why. The
All
reason
right.
why I don't know why is because this is complexity. Complexity simplified. There's no.
So does it mean that the other 30% will not respond to the stimulation as well? That's why we decide that 70 have and 30 don't?
Correct.
Okay.
Yeah, good question. So this only works on 70% of the population, and this is genetic. Genetic means childhood, adult, old age remain the same.
This formula only works on 70%, and the other ones work on the other 30.
Correct.
Okay.
Yeah. All right. Good, good, good. That's the next page we're getting into. Right here, 30%. Okay. 30% of the population have 5 element points somewhere else. Okay. Like the same pattern with the yin meridians or yin points. Yin starts with wood, fire, earth, metal, water in that order, right? In the well, spring, stream, river, sea. Wood, well, fire, spring, earth, stream, metal, river, water, sea. Those are yin points that were described in books. Okay. Nobody says these are related to yang points. These are yin pattern. But minor people, which is 30% of the population, that's like a third, maybe a quarter to a third, have 5 element pattern like yin points do with the yang points. Therefore, when you look at the yang meridians, gallbladder 44 is the wood point on a wood meridian. That becomes a new horary point that we didn't know about. Small intestine 2 is a second point, right? Wood, fire. Fire. Small intestine 2 is a fire horary point. Stomach 3 is wood, fire, earth. Earth point on a earth meridian. So that is the earth horary point. Large intestine 5, wood, fire, earth, metal. Fourth one is the metal point on a metal meridian. Bladder 60 is a husky water point. Then the question is, why nobody talk about it? Okay. Did everybody read the Yellow Emperor's Classic? Yeah, okay. Yellow Emperor's Classic. That was finished 1,300 years ago. And it is the canon, C-A-N-O-N of acupuncture. It was finished. But every few hundred years, there are some people who correct it or add to it. It is so good that only every few hundred years after that, people add to it or correct it. You know, the Yellow Emperor's Classic talk about the shoe points, right? Like, and how to do it. For example, tonify the mother to tonify the child, right? Or to tonify the mother to tonify the self, and then sedate the child to sedate the self. With that idea, 4-needle technique came out about 300 years ago. Yellow Emperor's Classic is comprehensive, but not detailed. For example, you get a puzzle. Let's say puzzle consists of 1,000 pieces. Yellow Emperors only give you 50 pieces, let's say. Now it's our job to fill in the rest of 950. So this information for the 30% of the population is discovery of what Yellow Emperor's Classic did not tell you. Okay. And how do I know this? Is because in the year 2000, a Korean scholar wrote a book on this. And he said 70% of the population has metal, wood, fire, earth, metal, water, wood, fire, earth progression. But there are other people who have wood, fire, earth, metal, water progression in the yang meridians. And I tested it. I'm the one who verified with acupuncture that it exists, because he was not an acupuncturist, he was a scholar. And he was doing 16 constitution acupuncture using 4-needle technique. I said after a while, I removed the extra stuff and only did the horary points. Came down to 2 ways instead of 16 types. And for all the patients, I give them 70% first. If they don't have an improvement, I give them 30%. Now there's a comparison. Now that logically makes sense? With so many people, okay, 100,000 treatments, 11,000 people. That's like 3,000 people, or maybe a little bit more than 3,000. Roughly 3,000 people had the 30% pattern.
So you would start on the one that worked for 70%, and if there was no effect, then you would go to the other one.
Yes. Okay. The effect can be immediate. It can be not immediate, because you know that even with the same points that are helpful, people do not have the same response every time. Therefore, you want to give 70% twice and then do 30%. If you do 70% once, maybe it was good, but for that time, the patient did not have an improvement. So you want to do 30% on the third visit. But what I do is I do 70% on the first visit, I do 30% on the second visit, 70% on the third visit, 30% on the fourth visit. Or I do 70, 30, 30, and then 70.
So you don't have an initial diagnosis per se, or differentiation when a person walks in and says, oh, this guy is the 70% population and this person is 30%. You do by trial and error, basically?
Yes. Okay, 2 replies. 1, I don't know if that patient is 70% or 30%. There is no information whatsoever that I could identify to see if I should do 70% first or 30% first. Not even one information. Okay.
Would it be possible to develop that at some point where you
Of
can
course.
actually know
It was
somebody?
possible to develop from 16 down to 2. Okay. All right. So then, yes, it's trial and error between the two. But the second reply is this. Think of any acupuncture that's more reliable than this. Any acupuncture technique more reliable than this? Any acupuncturist who's been doing 40-year acupuncture? Yeah, pretty good. First treatment, 80, 90 out of 100. 100 people, just one first treatment, 80 people get better, or 90 people get better. You know anybody like that? You know any technique like that? No, because there isn't. So I'm putting this into context here. We want 100% guarantee. Is there such a thing in any medicine? in any medicine, is there a 100% guarantee? Or any medicine is going to be effective on 100 people out of 100 people? No. It's a wish. That's why we refine as we go. This is the best we have.
Have you noticed doing those studies and doing this over and over? Are you able to, because you've been there the whole time, to see that like a patient and say like which one you'll feel like is going to benefit them just based on this experience?
Yeah, two main things. Well, three. One is at my clinic, there are two other acupuncturists. They have the same feedback, same pattern. And the other is I go outside and share the technique with other colleagues, and they do their volunteer service outside, and they get the same outcome, same benefit. And like Dr. Kumar, I post my stuff and you do them and go, oh, okay, this works, right? Then you have your experience. Yeah. Then that's why I know this applies anywhere and everywhere. Okay. And then I know Dr. Kim has also joined too, but I think he wants to like stay in the background. He's also giving me a feedback. Dr. Kim, he's with the Korean Acupuncture Association, and we have our own social media site. And you notice that I put up Korean articles, right? Korean stuff. Yeah, it's the Korean acupuncturist website, and he's part of the member there, and he's been doing acupuncture for Bisoma acupuncture for years, and he's seeing similar pattern over the period of time, 70-30, and the efficacy, and for a variety of conditions.
I'm just curious, how is this information taken in Korea?
Good question. I just translated my book into Korean, the Bisoma book. Yeah, that one. I just translated it. It's in Korean. And so now I need to let them know, market it. Yeah, things take time because there's a lot of voices that I can make. But when there's a lot of just continuation of stuff that are put out, eventually people know. And I do give seminar in Koreatown, and I did that last weekend, last Saturday and Sunday, 6 hours each on Bisoma acupuncture case study. What we're going over right now, this is the same material but in Korean language. Yeah, and you know, the California has the most number of acupuncturists. Yeah, in that way, yeah, everything is a grassroots movement. Good question. All right, any other thoughts? Okay. Now let's go over this. You've heard this. These are yin points. 70% of the population, liver 1, heart 8, spleen 3, lung 8, kidney 10, wood, fire, earth, metal, water. We all agree with this, right? This is what we learned at school. And this applies to 70% of the population. Next one, 30% of the population has 5 elements somewhere else, like yang meridians. Yang meridians start with metal. So metal, well, water, spring, wood, stream, fire, river, earth, sea. So metal, water, wood, fire, earth in that progression, like yang meridians, but these are yin. 30% of the population has this as their constitution. Okay, are we following so far? Yeah, lung 11 is metal point on a metal meridian. Kidney 2 is water point on a water meridian. Liver 3 is wood point on a wood meridian. Heart 4 is a fire point on a fire meridian. Spleen 9 is an earth point on an earth meridian.
I have a question. So if there's 4 formulas and each one of them work 70 and 30%, so it would go back to if you're one of those 4 formulas is going to work on you.
Sure, you can look at it that way. Yeah, we'll go further into the technique, but direct answer to your thought is this. There's a two treatments, two sets of points, not four. Why? Because yin points have the same benefit as yang points. Did I say that again? The efficacy of yin points are the same as the efficacy of yang point. Therefore, if yang works, yin works. If yang doesn't work, yin does not work. Okay? So this is not four choices. This is two choices. Okay? When do you use the yin points and when do you use the yang points? Those are common questions. You know why? Because in East Asian medicine, everything starts with yin and yang. And we learn to differentiate between yin and yang, right? Yin is nighttime, yang is daytime, yang is fast, yin is slow. All that. Male, female, yin condition, yang problem. There is no differentiation whatsoever. Yang points are going to be able to treat as well as yin points for any condition. Okay? Now, I prefer the yang points. I'll tell you why I prefer the yang points. It's because heart 8 is very sensitive. People don't like that heart 8 point. Lung 8 is right next to the artery. I don't want to risk puncturing an artery. Okay? So it has to do with safety and comfort. I just do the yang points. See, for several years, I only did yin points, not yang points. Okay? For several years. And I saw that it has the same benefit. But I also saw that heart 8 is sensitive. Okay? Lung 8, yeah, hardly I hit the point, but I don't want to tell somebody to use lung 8 because I don't know how the other person is going to deliver acupuncture on the lung 8. Okay, good. Now, this is the technique of Bisoma acupuncture. This is what you want to know. Okay, this is like ingrained in your method. This is the step-by-step way of doing Bisoma acupuncture. Number 1, choose yin or yang points. When do you choose yin? When do you choose yang? It's up to you. Doesn't matter. Same benefit. Okay, just choose yin or yang. I like yang because it's less sensitive, less dangerous. And then choose either right side or left side of the body. You've heard that saying, treat the healthy side. You've heard the saying, treat the diseased side. Have you heard that before? Or for male, treat the left. For female, treat the right. You might have heard that too. All don't matter. Because when I first started doing this in 2005, for like 3 years, I've only done the opposite as much as I can. Oh, I have a shoulder problem in my left. Acupuncture on the right. Knee pain on the left. Acupuncture on the right. Hip pain on the left. Acupuncture on the right. Far, far away from the problem. The result was good. But I don't want to keep repeating why I do it to the patient. This patient is like, that's weird. It's like, that's weird. Does he know what my problem is? Where my problem is? Kind of like surgery, right? Like, hey doc, I need to get surgery on my left knee, not right knee. You know, they put a big marker there. That's a joke, but it's counterintuitive. It doesn't make sense. But it doesn't matter which side you do the acupuncture. You choose right or left. So number 1, arbitrarily choose yin or yang point. Number two, arbitrarily choose the right or left side. Okay. And then number three, you got to do the 70% set. Right? Because it's like flipping a coin. It's not 50-50, but it's 70-30. Which one are you going to go first? The one that has double the likelihood that it's going to work. And you do that one time or two times, no relief, then you change the points to 30%. Needle retention, I like 20 to 30 minutes.
So when you choose, let's say that you decide to choose the yin points on either side, right? Or yang point.
Yeah.
You do the 5 shoe points?
Yes.
You do all of them.
All of them.
And you start from the metal, water, wood, fire, earth.
I start with the
It
left
doesn't matter.
spot. Fingertip, toes are most sensitive. So let's say I choose yang points, right? Okay, and I choose the right side, and I'm going to put in 70%. So that'll be stomach 36 first, small intestine 5, gallbladder 41, UB 66, and then large intestine 1. That's 70%, right? That's not helping. Okay, I'm going to do 30%. Then it's UB 40, large intestine 5, stomach 43, small intestine 2, gallbladder 44. Because you want to start with the less sensitive spot. Order is not important. The order you put in, the order you take out, not important. Okay. And you could only do one side of the body. Why? Because both sides can be 70%, or both sides can be 30%, or right side can be 70, left side 30, or left side 70, right side 30. Okay? You don't want to give the not working spots. You don't know how that person's 70-30, where that 70-30 is. Okay? So you have to do one side at a time. Let's say right side is 70, left side is 30. Okay? And you gave acupuncture on the right side 70. Ooh, got better. Okay? And you did it 2 or 3 times. Oh my gosh. Better. All right, good. And then next time you do acupuncture 70-70. Now you got correct on the 70 on the right side, but on the left side, it's supposed to be 30, but you did 70. You know what the result is? What does that look like? 0. Nothing. Maybe 1.
I saw.
I'm sorry?
Why it's like that, sir?
Okay, I'm going to compare this, all right?
Yeah.
Easy way to do this is make it simple. Roll over a bed of nails. Does that work? You might feel good, but it's not treating anything. You have to be specific, only the optimal. If you put in other things, then it's going to confuse the body. Like music. You play music, piano, and then somebody goes ding, 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 some other keys, right? Now it's like, I can't follow the music. It's like that idea.
Actually, energy is flowing. So like if we are putting one side of the body, so if we are putting other side of the body also, then it will work so fast, no, sir?
Then it'll work what?
Like if you are putting in one leg, like, in one meridian, one side of the meridian, like right side. And if you're putting on the left side also, then energy flow will be more, right?
Don't think
And
more
more healing will
better.
come.
Two replies, okay? One reply, don't think more is better. Sweet spots are the best, okay? You do the sweet spots and that's enough.
So both the sides we have the same spots, right, sir?
I'm sorry, I did not hear your words.
Both the sides we have the same elements, like right side the same elements and the left the same elements. So
Yeah.
if we are putting the acupuncture points on both the sides, then it will enhance the benefit.
Yeah. So I gave you one reply, and the second reply is direct reply to your thoughts. Okay? Okay, first reply is only the optimal spots, more does not mean better. Okay? One side is enough.
Yeah.
The patients who come to me, like to my clinic, more than half, been there, done that, done everything. A little bit better or better, whatever, but they still have much problem. Acupuncture is not their first choice. Okay? They got to get better.
True.
Go somewhere. Okay, acupuncture, let me try it out. Oh my gosh, it's so good. And majority of them only need one side acupuncture. It's enough. Okay? That's why I'm saying sweet spot. One side is enough. Okay? Now, direct reply to your thought. Okay? Your thought is, why not both sides? Because both sides have 5 elements too. Okay? The answer is this. Some people, just one side, not enough. Like they're a little bit better, but not much better. Okay? Then I keep the 70% and I do the 70% on the other side. That's both side acupuncture, right? Okay. And then they get better. All right, good. Even better, right? You want to maximize. Then they're 70% and 70%. But if they don't get better, then you keep the 70% and then you do the 30%.
Yeah.
Now they're getting even better. Okay. But majority only need one side acupuncture, even for people who do acupuncture as their last choice. Okay. But as you do, not everybody has the same benefit. Some people 30% better, but you know they could get better 70%. Then you do acupuncture both sides. In that way, you figure out how much one side or what is it 70% or 30% one side, and then you do the other side too after figure out 70-30 one side, and then you figure out 70-30 on the other side.
Yeah.
Okay. All right, good.
Second question, sir. Is it possible to mix with Bisoma, Tung and TCM together?
Yes. You could mix Bisoma and Tongue together as long as you don't do shoe points. The 5 element points. There's there's 60 5 element points. Okay.
Yeah.
So if you add triple warmer and pericardium, then you get 6 horary points, right? But I did not test triple warmer. I did not test pericardium. So I don't know. But I tested a little bit. It looks like the result is about the same. So it's not super better. Oh, extraordinary meridian. It must be special. Well, try it out. Maybe the result not
according to the present condition of the client, we can modify it, right?
Yeah, right. Yes, that's your question. I said several things here. What I'm saying is that Bisoma is comprehensive, it's enough. Okay? But you could do also triple warmer and pericardium. That's extra. Okay?
Yes.
And then test it. Now, when you add more points like tongue points or scalp points, everything else you could do because they're not 5 element points. Okay? That's what I was saying. the 5 element points I use are 50 of them.
Yeah.
4 needle technique, when I first started with the 16 constitution, 8 constitution, even 4 constitutions, I used all the 50 points. But I did not use triple warmer or pericardium. Okay. Just avoid needling extra 5 element points unless you're doing it for the constitution. But you could do tongue, bisoma, back points, abdominal points, scalp points, ear points, everything together. Go ahead. You know the ear points are popular, right? Okay. The name is popular and it's popularly used. So sure, why not? Combine them.
My concern was it will not disrupt the flow of the meridians, right? Flow of the energy, right?
My experience is that it does not disrupt.
Okay. Thank you.
It's even better. Okay.
Yeah. Thank you, sir.
Okay, good. Very good. Now for the next one, yeah, yin and yang points have the same benefit. Oh, I gotta go with the statistics here. My clinic, okay, 1/3 have high relief, 1/3 have moderate relief, 1/3 has mild or no relief. That means 66% get good relief, okay, or relief to good relief. Outside of the clinic, 60% have high relief, 30% of moderate relief, 10% mild or no relief. Okay. Remember I said there's nothing that's 100%. Okay. But this is better than many, right? And why is it different in the clinic and outside of the clinic? Why? Because those who have stubborn chronic condition, I think there's something going on with they're less reactive to acupuncture. Average people out there, 90% are good reactive. And not just good, yeah, they're good reactive for most people, okay? But there are some people who are not reactive to acupuncture, and they tend to be the ones who come to my clinic after having stubborn and chronic problems. Maybe them being not so reactive to acupuncture means that in general, their bodies don't improve that well with medicine. So that's my thought, okay? And that's the pattern that I see. I'm saying this because some people are going to go, I do this, why is Bisoma not working? Because not everything is 100%. But when you're treating community, it should be 90%. For me, majority are stubborn and chronic problems. Been there, done that, treated this, treated that. They have to go somewhere, so they come to my clinic. So then I catch the people who fall through the crack. In a good way, I could say that, but I cannot help everybody who come to my clinic.
So are you saying that the people that you treat in clinic are more chronically ill or more complex conditions versus the people that come to a community setting where they have mild problems, not
No,
as severe?
because yeah, your question is that the people out there have milder problem and the people who come to my clinic have more severe problem? No, it's not that. I'm talking about reactivity to acupuncture, regardless it's a mild or severe problem. I've had a guy, he was stabbed and gunshot in his abdomen, chronic pain. Acupuncture, oh my gosh, crazy good immediately. And then when I came back the next day, he's like, yeah, still better, even after 24 hours. I'm like, okay, get 2 more acupuncture treatments today. Okay. I had another guy. He was riding a motorcycle. He hit a deer, broke his femur, and the x-ray shows this titanium, like long titanium. chronic pain. He felt like a 1 year and a half ago, and like he was starting to be able to walk without cane in a month or two. Acupuncture. And then I saw him 3 months later. Oh, he was better and still better. So reactivity is different from severe condition. Okay? People who have low reactivity to acupuncture tend to have chronic and stubborn condition. They seem to be correlated. I don't know why. Okay? So when you're out there and treating severe condition, don't worry, because who knows? They might respond very well. Does that help? Yeah. Talk about some serious stuff here. Pretty heavy stuff. Okay. All right. So that ipsilateral, contralateral, you know what that means, right? Ipsi means same side of the problem. Contralateral means opposite of the problem, same relief. Bilateral, also same relief. But some people, bilateral is better than one side. Okay. Well, the point that I'm trying to say is that more does not mean better, but sometimes you have to do more because the patient is not improving that much. Okay. All right, needling, we talked about that. Direction doesn't matter. Sensitivity doesn't matter. Okay, so we had 70-30, 70-30. We talked about the yin points and yang points, 70-30, 70-30, right? And male, female, anybody, anywhere in the world, it's the same pattern. It's like gravity. Okay. We will continue with the objective measurement and subjective measurement on the next Sunday, on the second webinar, because we have to talk about how do we measure things so that we know that the patient is getting better. Okay, we'll discuss that. And before we go there, let's just talk about this. And we'll go over case studies. Back pain, that's the most frequent condition. Heroin, addiction, brain chemistry, acupuncture, really good. Amazing, amazing good. Okay, very quick, and it brings brain chemistry back very quickly. Therefore, the withdrawal is very short and low. And that's what gives success to people, correct? Yeah. This brings chemistry back in the brain, the normal chemistry. That's why withdrawal is short and withdrawal symptoms are low. Poison. Bit by a poison, like what is that called? Black widow. Scorpion. I've had patients recover faster with Bisoma. Chickenpox. Acupuncture. Helps. Pregnancy nausea. Alcohol withdrawal. Liver failure. Acupuncture helps the liver to come back faster. How do I know? It's because when there's a liver failure, they develop ascites, A-S-C-I-T-E-S. That's collection of water, fluid in the abdomen, and it goes down to the legs. You see his leg, it's like big. It's edematic. There's edema in the leg. And so then he noticed that the acupuncture helped the edema to go away faster. That's related to liver. Okay, another withdrawal. Opiate withdrawal. Chemotherapy side effect. If you look at the number here, first chemo, second chemo, third chemo, fourth chemo, red blood cell count 3.9, 3.8, 3.6, 3.5. It remained the same. It goes down after each chemo. Red blood cells, anything that grows fast, chemotherapy kills. But acupuncture helps to maintain the number. This is quite objective. Long COVID. Bisoma. Even Bisoma treat COVID. During the COVID, I treated patients with patients, and acupuncture works. Crazy, huh? Crazy. Yeah. So we'll discuss this next time. So you want to prepare and read the case studies. That'll be easier for you. It'll be quicker to follow. Any other thoughts or questions?
I'm just curious, do you strictly only use Bisoma points, or do you still use points that you've been learning before you tested Bisoma?
I strictly use Bisoma, but I prescribe Chinese herbs to 1 out of 8, 1 out of 7 patients. In order for me to diagnose them, in order for me to give them herbs, I also give them dietary consult. Some people are allergic to nuts, shellfish, like some foods, even not good with lettuce, even not good with ginger, cinnamon, and turmeric. I tell them those are not good for you. You want to reduce them, but these are better foods for you. Okay.
So you're still doing a Sasang constitution diagnosis.
I am doing Sasang constitution diagnosis. It's the same diagnostic method as Ayurveda, medicine of India. Okay. And I used to do 4-needle technique. 4-needle technique increases meridian, increases element, 5 element, and decreases the 5 element. Let's say, for example, Tai-Yin constitution, right? Small metal, big wood. So then with 4-needle technique, I reduce the wood, increase the metal. The patient gets better. That confirms the diagnosis. Because if I increase the wood and decrease the metal, the patient doesn't get better. No adverse effect. They just don't get better. Okay. With acupuncture, you can verify what their constitution is. I've done that with 16 constitutions, 8 constitutions, 4 constitutions. I know how to do it, but Bisoma is so much easier, simple. And I diagnose the patient's mind, physiology, and body shape. That's genetic. That's in the gene. So what genetic information can I get to diagnose them in their mind, in their physiology, and body shape? And Ayurveda goes a lot into mind diagnosis.
So when somebody walks in, automatically you're already assessing their constitution before you're applying just like you would have normally before you do these tests.
Yes, I automatically diagnose people because it's fun. Okay. You know that saying, know thyself, right? How do I know myself unless I know somebody else? Right? So there's a compare and contrast. That's why it's fun. And also, you know where this is going, the application, not only acupuncture, but you're using plant medicine to treat internal organs, revive the thyroid, shrink the pituitary gland, Crohn's disease, ulcerative colitis. Herbs help many things.